This is Dr. Anand Sheikh, Assistant Professor of Pathology, United Medical and Dental College, Gorakhpur, Technology. The title of today's presentation is Cutaneous and Subcutaneous Mycosis. In this lecture, the learner will be able to classify fungi causing cutaneous and subcutaneous mycosis, discuss the properties of fungi causing dermatophytes, brief the transmission and pathogenesis of fungi causing dermatophytes, and brief the laboratory diagnosis of fungi causing dermatophytes. This is the anatomy of normal skin, showing the skin and its appendages like hair, sebaceous gland, and sensory nerve endings are present in epidermis, and the dermis contains the capillaries and sweat gland and the main body of sebaceous gland. In the subcutaneous tissue, there is fat, collagen, fibroblasts, arterioles, venules, and the muscle fibers. Superficial or cutaneous mycosis basically confined to the outermost or dead layer of skin, hair, and mucosa. Causes no typical discomfort, and it is limited to stratum cornea. It is caused due to the organisms present in the soil and the animal surfaces. Histologically variable depending on the properties of the organism, the host response, and the degree of bacterial superinfection. There are six types of superficial or cutaneous mycosis. Number one is tinea capitis. It is occurs in children and rarely seen in infants and adults. Caused due to the trichophyton, epidermophyton, and mycospore, transmitted by human to human, and mostly infects the skull. And the main cause of the cutaneous mycosis tinea capitis is infection inside the hair. Clinically appears as hairless patches of the skin, as like showing in the picture, mild erythema, crust formation, and scaling. For the diagnosis of tinea capitis, on microscopy, hyphae seen in tissues, and by using potassium hydroxide on several agars, the septate hyphae may be cultured for the diagnosis. And in the treatment, we can give terbinafine like Lamisil is a brand name, antisanic acid, Desinex, Miconazole, or Tolnafate. The another type of superficial cutaneous mycosis is tinea versicolor, and it mainly occurs on the upper trunk, highly distinctive in appearance, transmitted by human to human, caused due to Malassezi furfur, and clinically appear as groups of macules of varied size in color with fine peripheral scale for diagnosis. Microscopy or histopathology can be used, and a microscopy they shows highly released on the tissues, and we can culture the tinea versicolor by using potassium hydroxide, and they show hyphae and yeast and servers regarding, and can be treated by using oral fluconazole or enproconazole. The other form of superficial mycosis is tinea cruris, and it is mostly occurs in inguinal areas as showing in the picture. Affects obese men during warm weather. Predisposing factors like heat, friction, and aspirations. And the most common causative agents are trigophyton tonsillan, trigophyton program, trigophyton spondylitis. Transmitted as usual human to human and clinically appeared as upper inner thigh, most red pages, moist and red pages with raised scaly borders, and can be diagnosed by microscope as it is seen as hyphae in tissue and can be cultured in laboratory by using potassium hydroxide preparation on silver agar. This shows separate hyphae. We can treat it by terbinafine, like Lamisil, and dexanic acid, Cinex, Miconazole, or Miconazole. Another type of cutaneous mycosis is tinea pedis, also called as athlete's foot, as shown in the picture. It affects 30 to 40% of population at some time in their lives. Caused due to trichophyton, epidermophyton, and microsporal and transmitted from animal to human as well as human to human. Clinically appear as a result of bacterial infection and diffuse erythema and scaling initially localized to the web spaces like in the toes or fingers of the feet. Spread to the nails referred to as onychomycosis produces discoloration, thickening, and deformity of the nail plate. And by using microscopy, hyphae can be seen on tissues, and by using potassium hydroxide drapes, separate hyphae can be cultured separate agar, and it is treated by using terbinafine, amicin, and acetic acid, itraconazole, miconazole, and zolinafate. Another type of cutaneous mycosis is tinea corporis, as showing in the picture. It is a common type and occurs on the body surfaces, affects all ages, but particularly in children. Predisposing factors like excessive heat and humidity, exposure to infected animals, and chronic dermatophytosis of the feet or nails, caused due to trichophyton, epidermophyton, and microsporum, and transmitted by animal to human and human to human as well. Clinically appeared as expanding round, slightly erythematous gland with elevated scaling. By using microscope, it can be seen as hyphae in tissues, and by using potassium hydroxide can be cultured in subrods agar at separate life. And of course, again, it is treated by terbinafine like lamicil and dexanic acid, desnates, miconazole, migatin, and tortopate and the Another form of cutaneous mycosis is nigratinia occurs in the keratinized layers of the skin like PAM showing in the picture. Positive agent is Cladosporium ranici and it is transmitted by soil to open injury. Clinically appears brownish spot caused by the melanin-like pigment in the eye, as you people are seeing or watching in the picture. It can be diagnosed by using microscope and then it can be seen as hyphae tissues and by potassium hydroxide can be cultured and separates agar as separate type. Again, it is treated by using terbinafine, like lamictal icoconazole and topical keratinolytic agent. Subcutaneous mycosis. There are three forms of subcutaneous mycosis. Number one is sporotrichosis, and it is caused due to Sporotrichs scaly, and it's a dimorphic fungus. The more forms of sporotrichosis lives in plants. Yeast form occurs in human tissue, transmitted through thorn. Clinical appearance like painless local pustules or ulcer with nodules along the draining lymphatics, like people are watching in the picture, and the untreated lesions may wax and wan for years. It can be diagnosed by using microscope. On microscope, it can be seen as round or cigar-shaped burning yeast and tissues, and it can be cultured at room temperature. IV bearing oval cornelia and clusters that depict the corneal fruits can be treated by using itraconazole, and the brain is different. The second form of subcutaneous mycosis is bronchomycosis, and it is a slowly progressive rheumatoid infection, collectively called pneumonitis fungi due to dark-colored cornelia or type B, either gray or black. Occurs in the tropics and is found on bare feet and legs, caused due to Monaceae, Pieloflora, and Cladosporium. Transmitted through skin trauma and clinically appear as rod-like lesion with crusting abscess extend along the lymphatics, like showing in the picture. And it can be diagnosed by using microscope only. It cannot be cultured on any agar. On microscope, they show dark brown round fungal cells are seen in leukocytes or giant cells. It can be treated by using oral flucytosine or thiabenazole and local strategy. The third form of subcutaneous mycosis is mycelium. Caused due to soil fungi, Prettylium migrella. Actinomycetes such as nocardia can cause similar lesions, actinomycotic migraine. Transmitted through wounds on the feet, hands, or back. It clinically appears abscess with first discharge through sinuses, as showing in the picture, and can be diagnosed by microscopy of micropus or biopsy. Fungi containing opercular granules can be seen in microscope. Treated by using sulfonamide surgical excision is recommended. Thank you.